Hello, and a very warm welcome. I hope you can hear me now somehow.
Yes.
Perfect. So, a very warm welcome to Switzerland. I have seen the very first snow in the mountains today, and I hope we will get cozy in here talking about implementation practice. I'm very much looking forward to this final webinar because we will have some special guests, not only from Switzerland, which I'm specifically will introduce later on, but we also have a special guest from Canada today. And I will further talk about Julia Moore, who is with us today, after a few words about some Swiss things happening in the near future. And I'm very glad to give the word to Rahel, who will talk about the next Impact Conference.
Thank you, Tekla. It's a really great pleasure to be here with all of you on this evening. And I have the great pleasure to announce the fourth Swiss Implementation Science Conference that will be held here in Zurich. It's a bit more snow right now and a bit less color in the picture, but that's how it looks. We'll have a 2-day conference where the first morning will be with an exciting program of pre-conference workshops, and then followed by 1 day and a half of a mix of keynotes, interactive sessions, inspirational talks, oral presentation, poster walks, etc. So we really welcome you to attend this conference. You can find more information on the website by scanning the QR code. Registration is open, and we're really looking forward to see many of you here in Zurich. Thank you, Tekla. Back to you.
Thank you, Rahel. So I was promising you today an interesting talk about implementation practice, and of course implementation science. And I have the pleasure to welcome to our session Dr. Julia Moore, who is currently the executive director of the Center for Implementation. Dr. Moore has a PhD from Penn State in human development, where she was trained as an implementation scientist. She was researching the best ways to implement evidence-based programs and has since then worked on over 100 implementation initiatives. And we know her and the Center for Implementation for being able to communicate very complex concepts in an easy, understandable way, so that also persons with no scientific background can grasp the complex concepts of implementation science. And Dr. Moore has worked closely with provincial, national, and international organizations to apply implementation science. And I very look forward today to her talk. And yes, as I said before, later on we will also have a discussion panel with some implementation specialists from Switzerland, which I will introduce after a short introduction from Professor Moore. And then we will switch to the discussion panel, get back to the presentation, and have a very interactive session today. And later on, I'm looking forward to invite also the audience to contribute to our discussion so that we can all learn from this session. And I very much look forward to the talk from Dr. Julia Moore now. Thank you.
Wonderful. Thank you, Tekla. I am going to start sharing my screen. So I am so excited to be joining you all this morning. I am going to talk a little bit today about implementation core competencies and functions and implementation teams. And I think it's really important to understand the perspective that I am bringing. So while I was once trained many years ago now as a researcher, I am no longer a researcher. And I really spend all of my time trying to figure out how we can take implementation research, implementation science, and many adjacent fields and make them practical and useful and relevant for the people who are responsible for implementing, spreading, and scaling things. And we'll talk a lot about who are those people who are implementing, spreading, and scaling things a little bit in a moment. If this is of interest to you, we have lots and lots of free tools and resources on our website that you can go and check out to go see a lot of these different things. I will plug right now as well. There are lots of the images available in German. And so you can go and check that out on the website inside of our toolbox. You can go and see the German versions of a bunch of the images. So a huge thanks to the Swiss group for making that happen. Before we jump in though, I'd love to know who else is in the room here. Oh, no, sorry. Let me first tell you about our agenda in a little more detail, then an activity. So I'm going to start after our activity about talking about the roles in the system. So what are some of the roles and what's a framework we could use to think about those? Then this is going to be very, very interactive. We'll have an activity and then a panel discussion. Then I'm going to talk about competencies and functions. And then we'll have, again, an activity and a panel discussion. Then we'll have lots of time for audience questions and reflections, and then another wrap-up panel discussion and a wrap-up activity. So lots of interactivity as we go through today. But for the first activity, I would love to get to know a little bit more about who is here and in the room. So for a bunch of the activities, we are going to use the annotate function. And so you should be able to see probably at the bottom of your screen, but sometimes at the top if you have an old version, it should say you are viewing Julia Moore's screen. And there's 3 little dots beside it. And you can then click on the annotate feature, or you can click on this little pencil. And once that happens, a bar like this should show up. I would love for you right now, you can play with it. Go and try to put a stamp on the screen right here. You can find the stamps by clicking on the check mark tool. Perfect. You can pick any stamp you want. Someone picked a heart. I love it. Let's see if other people, oh, I see a star. The only thing I will flag is if you press this little circle dot, it does not always allow multiple people to do it. So it kind of erases the other people's stuff. So you could do a pencil and draw your own things, or you could use stamps like that. Wonderful. Also, thank you to Alexis who has posted the instructions in the chat. If you're having trouble, you can always post an answer in the chat. All right, so I'm going to ask everyone to pause. I'm going to clear all of these annotations, and I am going to introduce you to the next activity. So pause, clear your annotations, and I have a couple of questions. So what is your current role? And you can click more than one thing. It's all anonymous. Would you identify as an implementation researcher, practitioner, implementation support? Do you have a role of intermediary, maybe policymaker? I see some funders, and maybe other. And you're welcome to type in the chat. And yes, it is not possible on the phone. Some people have told me they've been able to do it on a phone. I have never been able to do it on a phone. Awesome. Okay, so lots of researchers, but then kind of a few practitioners, implementation support, a few intermediaries, some other, so a few different places. All right, I am going to clear all of these and ask you the next one. What is your career stage? Do you identify as a student or trainee, early career, mid-career, or established career? It took us a long time to come up with the word established because I felt like we were just coming up with things that said that we were old. And so someone suggested established, and it made me feel much better than the other things that made me feel like we were getting old. Oh, wow, this is wonderful. So across the board, but a lot of mid and established career people. I would say a lot of the webinars I attend have a lot more people at the earlier stage. So that's very, very exciting. All right, I'm going to clear these, and I have one more question before we jump in to the next part. What field or sector would you say you work in? healthcare, public health, education, implementation science, mental health, social services, justice, or other. And again, you can click more than one because I know some people feel like they live in more than one of these boxes. Wonderful. All right. So lots of health, public health, and a lot of people over here in implementation science, but a few people showing up in other things like education, mental health, social services. All right. I will clear those. Clear those as well. And take us on. So I'm going to pause your ability to annotate for the moment. We will have more annotations coming, but I just don't want stamps all over the screen as we present. So the first thing I want to talk about is the idea of roles in the implementation system. So one of the things in implementation that I think is not discussed or valued as much as it could and should be is the idea of thinking about who are the different people in the implementation system and what roles do they play. Part of the reason I think that we don't talk about it as much is there actually aren't that many frameworks about this in implementation. And we love our frameworks in implementation, as I'm sure many of you know. And I think that there's one framework, only really one framework that really addresses this, and people often don't know about it. It is called the Interactive Systems Framework for Dissemination and Implementation, but people refer to it as the ISF. And I'm going to walk you through the idea of the ISF and the idea of thinking about who are all the different people in the system and what roles do they play. So this is an adapted version of the image from the ISF. So if you Google it, they have a slightly different image, but we like to reimagine things based on our work with different audiences. And one of the things we did is we moved people who are the recipients and beneficiaries into the heart of change. So this is the idea that we are often doing work. Many of you said that you work in healthcare. So many of you are doing work to improve patient outcomes. But in order to improve patient outcomes, we are asking other people to change their behavior. Oftentimes, we're asking professionals like healthcare professionals to change their behavior. So the people who ideally might benefit for many of us would be the patients and or their families. And oftentimes we have healthcare professionals who are the recipients of the different programs and initiatives, guidelines, standards that we are delivering. So we are asking these recipients to change their behavior to benefit somebody else. But when we work in implementation, we recognize that there's a lot of different other roles in the system that need to be there in order to make that happen. For example, lots of people think about the synthesis and translation system. So let's take an example of guidelines. Guidelines aren't just produced. People have to go through and synthesize all of the research to say what is the best evidence and produce guidelines, guideline recommendations, maybe even implementation guides to say, hey, this is what we would like people to do differently in order to support changes and ultimately benefit these beneficiaries. But in our implementation work, we recognize that we can't just produce guidelines and have people change their behavior. And so we need other systems and other people in the system to support the work. For example, we might have people in the behavior change system. They officially call this a behavior change system. Oftentimes, these are the local implementation teams, say in a hospital or a public health unit, or within a school or school district, who are responsible for rolling out the actual changes that are being enacted. Sometimes they're called implementation teams, but lots of times they might be called things like quality improvement leads or program leads. They don't necessarily have that name and job title. In a perfect world, when we're scaling things up, when we're implementing in multiple sites, we would have a support system to help people in these implementation teams know about what does the research say on how we can actually implement the content, for example, of the guideline or program they're implementing, and to support them in understanding their capacity to implement. What does the science say about how we implement? We also have lots of other roles over here that fit into a lot of different boxes depending on the situation. Researchers are frequently playing roles in some of these different boxes. Sometimes we have brokers, conveners, I know a lot more funders who live inside of support systems, decision makers. And we even have examples where we have secondary implementation supports because we might be scaling and have kind of implementation teams, a kind of like regional team, and maybe a national level team. And so I find this a really great way to kind of unpack and think about who are the different roles in the system. And so with that intro, I would love to hear a little bit about what you think about some of these different roles in the system. So pull back, let me enable it. Pull back out your annotation tool. Again, if you can't annotate, you can type in the chat. So pull those little dots. Put hearts for the roles that you interact with, and a question mark for any roles that might be missing in the systems you are working in. I'll give you a moment. Wonderful. I'm seeing lots of hearts everywhere, a bunch of check marks in the support system, say some in the behavior change system, some over in researchers and funders and decision makers, and question marks around secondary supports, beneficiaries, the implementation team, the support system, conveners, maybe funders. So kind of a lot of diversity. What I think is great about this framework is you can adapt it for your context. You can make it look the way it makes sense for the context in which you are working. So with that, I'm going to clear these and pause annotations, and I will flip it over to Tekla.
Thank you, Julia. It's great to see so many hearts on the screen, and I now would like to move the focus to our panel, which I'm very grateful to have here as well. So let me shortly introduce you to Professor Marie van Schneider, Professor Rahel Naef, and Dr. Bastiaan van Grootven, who should now be seen on top, I hope, for every one of you. And I would like to start with Marie, who is a pharmacist by training and currently an adjunct professor of medication adherent interprofessionality and health communication at the Institute of Pharmaceutical Sciences of Western Switzerland, University of Geneva. I would, first of all, hear a little bit about your projects and your experiences with the different roles that we have just heard, and just maybe you could talk us through and where you yourself would, where would you place yourself most of the time in this implementation systems.
Okay, thank you very much for the introduction. So I'm Marie Schneider from the University of Geneva. I'm a pharmacist as background, and I'm at the we have a big implementation study called MicroStart, which involves community pharmacists, primary care physicians, and patients when they start a new long-term medication. The idea is to support adherence to new long-term medication through 2 times 10 minutes intervention between the pharmacist and the patient at drug initiation during the 5 first weeks. And this intervention had to be developed in Switzerland with the stakeholders in Switzerland and the end users, not only pharmacists, but also primary care physicians and patients. So that's the big project we are working now, funded by the Swiss National Foundation and the Commission, the Federal Commission for Quality in Switzerland. The role I'm seeing myself in, so as a researcher and a group leader, I have to secure funding for this kind of research. That's very important to be able to start the research with fund and be able to really to fund each step of the research. So securing funding is really important. And then is having a good team, having a team of people being able to do the work and to develop research and use implementation science during the different phases of the project. So having the team of researchers around the right team and being able to develop the competencies of the team is really key. Now, we have launched the project into the community. So we are in the second phase of the project, and to be able to roll out the new intervention in the community, we have built a team of facilitators. So facilitation is really important, and facilitators have been trained in this project, and facilitators are key because they are going to meet with the different sites in the community who are going to implement the intervention. So that they are going there, they need very specific skills. Maybe we can talk about that later. And these facilitators have just started their job during this project, and we can see that they are really putting the research team and the implementing team on the sites together. So they have a very important role. And then we also have champions in the different sites who are people who are going to embrace innovation and are going to be key in the sites to make the change. Okay, that's the point I wanted to bring now.
Mm-hmm. Thank you so much. Maybe we could shortly switch over to Rahel also. Maybe if you could position yourself, where do you see most of the times in your project, and maybe just briefly introduce what kind of projects you are currently working in.
Yes, thank you, Tekla. And again, it's a really big pleasure to be here with you tonight. So I'm a nurse and an implementation scientist based at the University of Zurich and at the University Hospital in Zurich. And a big part of our work is actually developing, testing, and implementing family-focused interventions, mostly in acute critical care settings. And in doing so, we have different roles. So maybe just to give you a bit of context, what we've done or just wrapping up is a Habitat 1 study where we really tested the ficus intervention. It's a nurse-led interprofessional multi-component support intervention in critical care, targeting families to better support them and also to reduce adverse health outcomes for them. And what we did actually was kind of as part of the study, we had kind of a tailored implementation strategy where we did different things, and some of the roles that we had in there was local champions as well. These were often the persons who took on these family nurse roles in delivering the intervention together with leaders. But we also had a specific role, which was called internal implementation supporters. So sometimes these were advanced practice nurses. Sometimes it was an experienced ICU nurse or also a group leader there. And we also had external implementation support or facilitation that was actually provided by our team. So oftentimes we kind of have the researcher role, and also, as Marie already mentioned, getting funding for these kind of projects. But then there is also kind of the role in a support system that we generate through the research projects to actually enable organization and teams to do this work. So what we also do now, as we're wrapping up this trial, we now just got another grant from the Swiss National Science Foundation to actually go into studying scale and spread of this intervention that we found to be effective in improving quality of care. And there we want to learn more about which roles do we really need. Because sometimes we do a lot as researchers to implement something. And then it's also lots of resources, and that may not work at the long term. So it's also important to know what is really needed and what kind of roles or then also strategies are needed to really spread it and scale it nationally. So we're now going at national scale across Switzerland. Before it was just in the German speaking part, and really better understanding what is it that's needed to embed it, but also to not increase the workload too much on the providers actually who deliver it. And maybe just before I wrap up, another important role that we found was actually one of the beneficiaries or the users. So really having patient and family advisory boards and partners working with us in thinking about how we need to do this also in a way that it's implementable and acceptable to families who should be the beneficiaries of this. So back to you, Thekla.
Yes, thanks a lot, Rahel. I'm very much looking forward to continue this discussion later on, specifically about the competencies of the people, because I think that's a major topic to be discussed today. And now I look forward to introduce you to Bastiaan van Grootven, who is a postdoc and an SNF Ambizione Fellow at the Institute of Nursing Science, University of Basel. And Bastiaan, to you the question as well. What is currently your role in most of your projects that deal with implementation science?
Okay, thank you, Thekla. So I think I'm a full-time researcher at the Institute, and I think project probably follows the same structure as everyone, where we have the direct collaboration with adopters and then a larger stakeholder group with people from policy, end users, support system, and behavioral change system, where we try to involve everyone in co-design. Evidently, when I reflect on it, maybe it is still too passive, where actually the support system itself is not fundamentally supported enough. And we have currently a large national implementation program in long-term care led by Professor Francisca Zuniga, and she was able to flip the script, where a national organization representing long-term care actually was the applicant for the grants, and it's a support system that contracts us as a research team to do research for the field, and that's a fundamentally different structure of collaborating and of running a project in such a way that the support system is strengthened through the grant, but also through the research that is fully committed to their needs. And you also see that through that structure, the interactions with everyone in the field is so much easier. Also from a research perspective, recruitment runs through the support system, so we have direct access to everyone. So I have very, very positive experience there in this alternative format, a little bit less traditional academic and maybe more practice oriented.
Thank you, Bastiaan. We're looking forward to discuss more and to hear about the other ideas about how to also include other perspectives and competencies to the table. And with this, I would like to give back the word to Julia.
Wonderful. What I loved about all of those examples is you illustrated how the different roles in the system exist in all the different examples, but who is driving the work, who might be funded to do the work, like are all different, but you can identify and see those like buckets of people and how they're connected and interacting together. And I think that that's what's so amazing about using a framework like the interactive systems framework is people can visually draw out their system in a way that makes sense for them. And everyone's system is not going to look different. And in fact, it doesn't even look the same over time. And I think that that's just an amazing, amazing way for us to think differently about our roles in the system. So next, I want to get into a little bit about the competencies and functions of supporting implementation. So first, kind of one of the common questions I get is, well, who are these competencies and functions relevant for? And why would we use these? And so what is interesting is when we first started developing competencies, in my head, I think it was for people who were in that support system and kind of exclusively people in that support system box. But over time, we have been encountering more and more situations, exactly like the 3 examples that were just shared, where people who play a lot of different roles in the system also play the role of supporting implementation. Many researchers might not have started believing they would be implementation supporters, but that's part of the role that they end up playing. There are lots and lots of people who might be clinicians embedded within organizations who suddenly play implementation support roles. So there's a lot of other people who may never have the job title that says implementation support, but that is the function that they play in the system. And so what are the competencies and like how can they help us? So a couple of reasons I think it's super helpful to have competencies is we can use them to help with career trajectories. That was the call we got from people. They said, I have skills in supporting implementation and I want recognition of like the skills that I have. I think it can also really help us in helping people build skills and in building trainings to make sure that we are addressing the competencies that people need to do implementation support. It is also super helpful in creating job descriptions and for anyone who wants to understand what people who are supporting implementation do. So several years ago, we did a bunch of work collapsing different existing competencies related to supporting implementation. There are great competencies for implementation researchers, and some of those competencies are relevant here. But people supporting implementation don't need the research methods components, so all of those are pulled out. But we've identified some additional competencies that people need to support implementation. What I really like is they're pretty obvious. Like when you hear them, they don't seem surprising. What are some of the things people need to do? They need to be able to develop a team because implementation is a team sport. We are never doing this alone. And so we need other people that we can work with to support implementation. We need to be able to unearth the problem. This is about digging really deep and truly understanding the challenges and the problems that we're encountering in the systems we're working in. Sometimes, but not always, people need to know how to select the thing. So in some situations, people are assigned a role and they're saying, hey, we have a problem to deal with. Can you go find a program, a practice, a policy, a guideline that can help us address this thing? Other times, people are given a thing and told to go and implement that thing. So this is not relevant for everyone. I think for some roles in the system, selecting the thing is very important. Everyone needs to understand how to assess barriers and facilitators to change, and to think about that at multiple levels. What are the individual barriers and facilitators? What are the contextual barriers and facilitators within, say, the implementation setting? And that outer or system context. And then we need to be able to use that information to select and build out what we call change strategies. We know that they're called implementation strategies in the literature, but the people we work with prefer the term change strategies. It seems less daunting, but to build out those implementation or change strategies. Many times, and increasingly, people recognize the importance of being able to adapt to the local context. Oftentimes, it is those people who are supporting implementation who need to directly make the adaptations or support others to make those adaptations. And we are hearing increasingly that this is a challenging part of their roles. A big part of the role is to plan for implementation and then literally to actually go and enact those implementation plans. A part of this is about continuously learning and improving. I always tell people, I teach a lot of people about implementation, and I frequently tell people that if they feel like things are really easy and they feel like they understand it all, they have definitely missed something and they should come and see me, because I spent my entire life trying to figure out how to teach implementation science, and I am confused more than I feel awesome. And so I always think that if people think that this is easy, they're missing something about what is happening in implementation. And we need to show up with this mindset of wanting to constantly improve, especially since the literature is developing rapidly. What we know about implementation changes every year. So we all need to be continuously learning and improving as we go. The last two aren't relevant for everyone, but I think that they're increasingly important, and I'm seeing them more and more. Lots of times, people are also responsible for planning for sustainability and enacting those sustainability plans. And sometimes people are also responsible for supporting spread and scale. And we are seeing this more and more. And I think that there's kind of some very unique competencies related to spread and scale that aren't embedded in some of the others that we can think through. So this is a super high-level overview of the 10 competencies. The number one question I get when I present these is, does one person need all of these competencies? And the answer is not necessarily. Oftentimes, we need a team of people who have the collective of these competencies. So let me give you an example. I spend my life literally teaching these things, and yet I am not very good at selecting the thing. I don't have a topic area. I don't have a deep knowledge of the literature on any specific topic, so that's not a competency that is super strong for me. Other competencies, like adapting to the local context, is one of my passion areas, and I have spent a huge amount of time digging in there. So I think it's about recognizing which of these might be strengths, which of these do we not necessarily have that maybe we could be enhancing and that would really enhance our work, and which ones should we identify different people on the team to take on. There are some, though, I think everyone should have. Unearthing the problem, barriers, facilitators, and selecting change strategies feel very foundational to implementation science and kind of feel like everyone should have at least a good grasp of those. When we started building these competencies, though, one of the things that started coming up was there was this part of supporting implementation that was not related to the very technical things I just talked about, right? So those 10 things are pretty like concrete, like build a team, assess barriers. But there were these things that kept coming up that felt less tangible. They felt super, super important. Especially, we just heard an example about the role of facilitators and how important that was. And it's like, these are the things that are so important in order to support implementation, but that might be less technical. And so we ultimately called these the 5 functions of implementation support. So these are the things that everyone who is supporting implementation often needs to be able to do. We need to be able to understand, deeply understand people's perspectives, deeply understand the context, deeply understand the problem. A huge part of our role is getting to deeply understand what's happening. A second piece is that we need to often build connections. Implementation is a team sport. Relationships are essential for all implementation work. And so we need to be able to connect with different kinds of people in different ways to do this work. Third, we often need to inspire people. A large part of supporting implementation, people used to call being a cheerleader. Sometimes we need to show up and cheer people on, support them, inspire them, motivate them to want to change, to want to use a framework, to want to embed evaluation, to want to do the work differently. And so part of our role is sometimes to inspire people. Part of our role is sometimes to enable change. That means removing barriers and making things easier. So sometimes that involves understanding what's happening in the system and figuring out what can we do to make it easier for people to change. Sometimes at that more individual level, but oftentimes at the organization or system level to create change. And we finally have this function called transform. And this is about the fact that in order to really effectively support other people to change, we need to be able to pause and sometimes look deeply at what we and others are bringing to the table. What are our own biases we're bringing? What are the values that we hold? How can we reflect on how we are showing up? Especially because implementing change is often an emotionally triggering process for people. And so how are we navigating all of those pieces, and how are we kind of holding up the mirror to ourselves and our teams and transforming within? And so these were kind of 5 functions that came out in the work that we did when we synthesized everything we could find on core competencies. A couple things about the competencies. So if you want to dig deep into them, we can link you to the resource, or if you just look up the Center for Implementation Core Competencies, we have lots of resources. We have descriptions of them, including what they look like at 2 different levels, a foundational level and a more advanced level. Because I think for each of these, there's kind of a foundational, what you need to know, and then there's a deeper level. And then there's descriptions of the specific skills and knowledge that people have. And we know a lot of people are using these to build job descriptions, to describe to others what their jobs are, and to kind of craft out how teams are working and working together. Plus, they're using it to actually build their own skills. For example, we have this self-evaluation quiz where people can go in, rate themselves and their competencies, and kind of say, hey, which ones do I recognize I want to work on right now? I was just having a conversation with someone who said, hey, I thought I wanted to work on building sustainability skills, but once she looked at it more deeply, she realized first, she thinks she wants to spend more time on adaptations before getting into sustainability because of where they are in their work. So I think it's a great way to kind of think through what do we need and where should we go from here. One thing I want to say, though, about competencies and implementation is it's like a roller coaster. I, for years, have wished that we could have a visual depiction of the emotional experience of learning about implementation science. It feels like there's this moment early on where people learn about implementation science. Some people are excited, some people are hesitant. They jump in. They jump in, and right at the beginning, it's like people often feel like, ooh, this is fun. Very soon afterwards, there is a big drop where people are like, whoa, I thought this was fun. Now I'm overwhelmed. You have too many frameworks. You have too many terms. You have a terminology problem. I am overwhelmed. I am confused. Interestingly, then we start building our competencies in certain areas. And oftentimes we find that people actually build their skills, but at the same time, they become less confident sometimes in their own abilities. It's almost like the more people know about implementation, the more they realize there is to know. And then they suddenly feel like, ooh, maybe I don't know enough. And I actually just think we should be open about that and let's talk about it. That's the process. That's what it often looks like for a lot of different people. And so let's support each other as we kind of go through this roller coaster of, yes, I get it. No, I don't get it. Oh, this seems easy. Wait, I don't understand this part. And that's kind of the experience of learning about implementation. The last thing I want to talk about is how I present implementation to people who are supporting implementation. So these might be people who are researchers supporting implementation. They might be people who have an implementation support role. They might be clinicians who have been tasked with supporting implementation. They can be a lot of different people. And we've been training people for 15 years now. And I've been thinking, I've done a lot of kind of self-reflection on which things work really well. Many years ago, we used to start by introducing theories, models, and frameworks in the first module of our courses. We no longer do that, and we save it for the very last module. We teach people theories, models, and frameworks, but we don't tell them we're teaching you theories, models, and frameworks until we've already done it. Until they see, hey, I actually used 2 frameworks, a theory, and 2 process models, and I understood what I was doing. So where do we start? I have historically never told people this, but I feel like it is helpful, especially in preparing for this talk, to think about where do we start sometimes if we're supporting people who are not necessarily deep in the implementation science world. We have found it is easiest to start with process models and with tools. Those feel the most accessible to people. And so we have two process models that we kind of use as the starting foundational place. You can see how they link directly to those competencies. The first one we call the strategies pathway. This is very similar to implementation mapping or the knowledge to action cycle. So very, very similar. It's kind of a synthesis of existing ways that people think about this. It talks about starting with exploring the thing, like developing your team, understanding needs and gaps, goals, and selecting that thing. Then in getting into defining who is being asked to change, what they're being asked to do differently, assessing those barriers and facilitators, and then selecting change strategies. While recognizing that all of this work relies on good relationships, engagement, and planning. And this often feels like a really concrete way for people to jump in. They're like, yeah, that makes sense to me. I can think through these fairly logical, sort of linear steps at the beginning. The second process model we use is we call the implementation, spread, and scale pathway. This one is very nonlinear to address the fact that planning for implementation is very nonlinear. And we talk about how we need to do things like identify and build supports. So who are those people in the system? What are their roles? Who's on the implementation team? Who is supporting implementation? We need to assess and address things like readiness and context. We need to plan for things like adaptations, implementation, sustainability. We want to operationalize those plans, do things like implementation cycles and pulse checks to see how things are going. And we want to be evaluated. These are nonlinear, people bounce back and forth, but we found that it's a really helpful kind of start here. And as many of you probably see, framework, theories, models, and frameworks are embedded in the different activities within these. So we have found that a really great way to introduce the concepts of implementation science to people who are newer to the field. Final thought before we jump into an activity is I wanted to flag again that all of these images I have shared are available. Anyone can use them. Do not email us. Anyone can go and use them. And we have German translations of these images available on the website as well. Huge thanks to this group for making that happen. So let's jump into our very next activity. Again, I would love for you to pull up your annotation tool and tell me which of these competencies you think are strengths. You can put a little heart beside. And which of these competencies for you or maybe your team do you think that you would like to explore more? So you pull up that annotation tool by taking those three dots, get the little panel, and then perfect. Yep, go put hearts and put your little question marks, and I will give you a moment to do that. Wonderful. All right, so lots of hearts in these early ones, developing a team, problem, select the thing, and barriers. Actually quite a mix here in building and selecting change strategies. I will put a plug, I'll put a link, or maybe Alexis can put a link. We have a tool for helping people select change strategies. It is being updated right now and will be available in, I don't know, early to mid 2026. But we have a tool called Strategies that helps people do that. Lots of hearts for local context. And then we get into more and more question marks, especially as we get down into sustainability and spread and scale. I love this topic. We just finished filming, or we're editing videos for a new course all about context at scale and what do we know about planning for spread and scale. And I think that's a really interesting direction as a lot of people are scaling their work more and more. So I'm really excited to see lots of interest going on down there. All right, so I will clear these and I will flip it back over to Tekla.
Yes, thank you, Julia, for this very interesting tools you provided us. And yes, I was looking at it myself and seeing, yeah, I can get why there are so many question marks on the sustainment phase. That's why I would like to use our panel to get on their experiences in the projects. How do you, in general, deal with putting your team together, thinking about those kind of competencies, and who should be the knowledgeable person? Or, I mean, first of all, to reflect on your own strengths and weaknesses, maybe, but also to think, who could I bring into the team to be the person who brings this or that competencies? I wonder what your strategies are in the beginning of a new project. And this time I will start the other way around and ask Bastiaan.
Thank you, Tekla. I think my reflection is, and I think that's probably for most of you, I think we manage well to put a team together that understands the problem, that can analyze it systematically together with the fields, understands the contexts, identify barriers. I feel most PhD and postdoc researchers in our fields are well equipped with that. What I've noticed that I miss, and it's one of these competencies, I think, select change strategies. There's quite some guidance on that, but I feel build change strategies, that's a whole other level. When an implementation problem has to do with knowledge, I think we can agree that education could be a solution and we could probably figure it out. But admittedly, if the problem is self-efficacy, I cannot do, for example, a modeling strategy. For that, you need psychologists. And we do have good experiences with doing consultancy with psychologists, but I feel that's, for example, one of the knowledge systems that we are missing in our projects, these broader disciplines like behavioral science. Some profiles that we also miss, and I think quite challenging to find, is maybe communication experts when it comes around designing informational materials, and also maybe educational experts when it comes to designing training programs, which could be useful for especially trainer-trainer concept and scale-up projects. So I feel, a core we have, but the build change strategies and planning for sprint and scale, I feel these are really the challenging ones where we have to look to outside help with consultancy.
Mm-hmm. Thank you. And specifically, I mean, at which phases? I mean, there is like if you begin from the very beginning, you can spend years just preparing. I mean, how do you deal with like ongoing changes? I mean, is it possible in your projects to add not only an expertise and external, but also maybe to train people with specific competencies?
Reflecting on it, I'm sure it's possible, but I feel we are all limited by grant funding, which means we overpromise and don't receive enough to build the perfect team. So I don't have the answer for you, Tekla. Maybe the colleagues have other experiences.
Yes, maybe Rahel. Do you have experience with learning on the way? I mean, sometimes it's not as obvious in the beginning that you need something or some specific competencies, or you see something is not going so well while in the process. How do you deal with this?
I mean, I guess we're learning all the time as you go through the processes, even when you have a very systematic, thoughtful, strategic planning process, very systematically defined implementation activities or change strategies. You always learn as you go because things change over the course of projects as well. And I mean, what we maybe observed is that you kind of often, and as you, Bastiaan, said, we really focus on the beginnings. And then the question is, how do you actually make it stick? How do you adapt to changing contexts and constellation, especially when the project takes longer than a year, which most often it does? And how do you then really build also for later sustainment and sustainability of practices? And so looking at the competencies, I think the last three are really those that we don't really know. I mean, we've kind of been lucky to work in contexts where there is already quite a bit of knowledge of how to achieve changes in complex practice settings. And often, especially for instance, if you have somebody who has a master's degree in nursing, has already learned quite a bit about implementation practice, but also, earlier around how do you manage change, how do you work with team processes to actually do this. They often are quite resourceful in adapting that. But then, it's doing as they go, and it's not really this systematic reflection of what has worked, what hasn't worked, and how do we need to adapt. So sometimes I find it really hard to disentangle, how we do it, where there's kind of this synergistic happening all at once within these projects as well. So I'm not sure if I've really been able to answer the questions, but maybe just offering kind of a reflection of the complexities also that happen. Even when you have very well specified strategies with many experts that have contributed to that.
Thank you. Maybe Marie. So we had Rahel, who was mainly working in the field of hospitals, which you said it's specifically university hospitals. There's a huge group of expert or professionals with a master degree, and also there is the proximity, which I always think is really an advantage. But working in the primary care sector, you do not have these clustering as you have in a hospital. So you deal with different providers, and it's not a group that you can easily get together. And how do you compensate for this from your team perspective? So how do you team up to deal with this challenging situation?
Thank you for the question. First of all, as I said before, we use facilitation. So we trained our facilitators to go and meet with the sites, with the different sites in different languages. So those facilitators, the leadership of these facilitators is crucial. They have to understand implementation science. They have to understand how to collect the data we need, implementation outcomes. They have to capture the barriers and facilitators on the different sites. Each site has different barriers or facilitators, and they have to learn how to identify the right strategies to answer the barriers in each site. So facilitation is important, and then on the site we ask each site to have at least one or two champions who are the innovators in the pharmacies or in the general practitioner offices. So we are really building this network. At the moment, we just started beginning of November. So that's pretty new. And what we have already is that it's really important for implementers on the different sites to understand who are the team of researchers, what we are doing, how we can help them. They feel supported, and that gives them energy to implement the new activity. What we also do is every month we schedule a round table where people from the different sites can log and meet together. Even if they just come for 15 minutes, they come for 15 minutes or 45 minutes if they have time. And we put them together to try to start building this community of implementers who to train them and to really inspire them. And they are going to inspire us too. So it's a two-way direction. And I think it's really about, as Julia said, it's about emotion. There are a lot of ups and downs. In Switzerland, we are I've been starting this project with my team 3 years ago. So we are quite new. We are learning a lot on the way. Being within the impact community helps us because we can learn a lot through the impact. Education is really fundamental. Educating change, how to management of change among the implementers, among pharmacists, physicians, nurses, all the professionals that are, educating them is really key, and educating them with the same language, being able to educate them on implementation, on change management with the same language between the different schools in Switzerland. And the last thing I would like to say, Switzerland is quite a small country. I think implementation science is all about transformation of healthcare and beyond healthcare too. I think teams from different universities, different institutes really have to work together. And this capacity building, this teamwork spirit needs to be learned, I think, in Switzerland. That's what I wanted to say. Thank you.
Yes, thank you. I think, yes, we will come to the specificities of the Swiss context in a few minutes. And maybe I can ask you one more question. Like you talked about champions in the system, what professions are these, or like what do they bring into your project? Like what is their background? Are these pharmacists or like from the same profession, or what were your thoughts on this?
Yeah, they are either pharmacists or technician in pharmacy assistants. They are part of the internal team of the different sites. They also are physician, general physician, or we'll see. We haven't started yet with the physicians. There might be other professions in the general practice offices. There are really people who could inspire the team, who understand what the intervention well, and who really can help think and implement the change into the different sites. So they are very much in touch with our facilitators, and we think, but we have to experiment. We are just at the beginning. We think that those champions are really key to think and reflect within the team on the new service they have to implement.
Mm-hmm. Thank you. Maybe we could move to the other two as well. We heard a lot now about inspiring, engaging, supporting, but there's also the many question mark that we have seen, topics about sustainment, about spread and scale. If you think about your projects, I feel always there's a lot of responsibility on you, being in the lead. but how, like, what kind of collaborations did you think about to get into the sustainment, or like who do you take on board to really discuss sustainment? Do you have experiences with working with some cantons, some national level organizations or support systems to really talk sustainment?
I have to answer the question, or Rahel, do you want to go ahead?
Yeah, maybe just briefly, because I think Bastiaan has quite a bit to say about this because of the project you mentioned. I mean, we are actually now really thinking hard about who to partner with, because as you said, Thekla, often if it's as part of a research project that's funded through these national bodies or foundations, and it's mainly about doing research, you become a resource system that may not be sustainable at all. But it's quite difficult, especially I mean, many healthcare systems, but also in Switzerland, who could these partners be? What are kind of national organizations or professional organizations do you have in the area who actually will be able to generate the funding to then really support or provide implementation support? I mean, we've for instance worked with the Swiss Society for Intensive Care Medicine, who is kind of an umbrella organization, but to really try to think about, and we will also continue to think about how could, you know, what could be, who could take on the roles of really creating a support system that's long lasting and goes beyond the project. But I'm not sure if we really have a sufficient structure for that. That really goes beyond one single healthcare organization. I mean, hospitals sometimes have support structures as well, right, or systems in place. But beyond that, and that really is a system question, I think, where we don't really have an answer to it. And Bastiaan, I would be really interested to hear in the project you mentioned about the, you know, flipping it around and having actually a national organization who's the support system, what some of the learning is from that project, if you already have some.
Yes, definitely. Well, I think I have two contrasting experiences. The first is maybe a more negative one from my own project, where we do work with the health departments of the canton, with insurance agency, professional organizations. It's a community setting project centering around the older adults. So we work with nurses, physicians, physiotherapists, dietitians. Everyone is interested, but when it comes to investing money in it, that's then often where it stops. So even involving everyone into the project, having them in a stakeholder board, doing workshops, this has not for me been the success factor when it comes to sustainability. And I think that's a little bit disappointing. One thing that I learned rather new is actually scalability assessment in your project. And I've not really seen it in project. I only picked it up this last year. And actually, when you start developing your intervention, your strategies, you would already think ahead to the implementation system. And do they actually have the resource and the capacity to do this? And then maybe sometimes the inconvenient answer would be, well, it's not scalable. Maybe you need to rethink it. Goes a little bit maybe against our grants. So I think that was maybe rather the negative experience, but I think we do have quite a positive experience with our national implementation program in long-term care, where, as said, the support system is really driving the implementation, and that means that they talk with the cantonal organizations, they have access to all the major national professional organizations, and also connection with other support systems like continuing training institutions, IT infrastructure. And there, in the span of 3 years, we were able to develop, do a context analysis, of course, a traditional approach, develop an implementation program, and now in March, we will launch Scale Up to 8 cantons. And that is only possible because we have that national organization leading the way and doing all of the political negotiations at cantonal level, and you know, doing the convincing, the inspiring, the motivating, being the champions for all the work that we do. And our role is basically it's to develop materials for a support system. I think that's how it works. I think it's great. The downside is it's not a traditional academic project. It's not about publications. The large majority of our work is not publishable, I think. We spend so many hours into designing training curriculums. So unfortunately, that doesn't work for competitive funding. But I think, when you have the funding through maybe government, for us, it's been a success solution.
Thank you so much. I think we could open up a whole discussion about research, practice, academic funding, academic publishing, implementation work. I mean, it's a whole other webinar, I think. And I see Julia now. I think we would like now also to invite the audience. I saw already some activities in the chat happening, and I would like to all invite you to put your questions in the chat. And if you would like, you can also raise your hand and we will bring you up to the panel. So I saw one question from Anna Bergström. I'm not sure if she would like to
speak to that. Yeah, so I provided a response to Anna in the chat. But I think Anna's question was about whether I'm talking about implementation science or implementation practice. And I think that this is a very challenging topic because even within our field, the field doesn't agree on what the field's definition is. We, for many years, used to say we were taking implementation science and bringing it to practice. So one of my first slides was a bridge, and we had implementation science on one side and implementation practice. And we received a lot of feedback that it should say implementation research on one side to implementation practice, and that implementation science was the umbrella over top of both of those. And so we changed that a couple of years ago. But my answer to everyone related to terminology is there is no consistent terminology. The key is making sure that everyone on your team and everyone you're working with knows what you mean when you use certain words, because we are all using them differently. They're differently described in the literature. And so I think we just have to make decisions sometimes about what that looks like. We talk about our work most often as implementation support, not technically the practice, because some people would argue the practice is one level lower than a lot of the work I'm talking about. I'm talking about people who are supporting one or many different sites to implement something. So I often describe it as implementation support. I think it's a great question and a huge challenge for the field.
Yes. Are there any other questions for Julia or our panel? There is one hand from Dilip Kumar. Please go ahead. Maybe you
Hi,
shortly introduce yourself and then we
yeah,
can.
yeah, sure. I thought it's good to, just pop in the panel and ask directly question rather than writing in the chat box. So, I'm Dilip Kumar. I'm based in Manchester, UK. I work for a charity which is called Manchester Global Foundation. By qualification, I have also pharmacy background, which Mary already, mentioned. She's also a pharmacist but I'm also a public health specialist. I have more than 15 years experience working in public health. Recently, I have got interest working and learning implementation science. I did not know that I'm already working. I'm implementing different public health projects. I did not know that I'm already doing that work, but since last few months I realized that I was already doing that. But now I formally started realizing and recognizing that. So let's start formally learn that and doing that systematically. So my question is regarding, I'm working here in UK. We work with ethnic minority groups, with Afro-Caribbean group, with South Asian and other Asian communities. And we are working also in South Asia and also in Africa with different regions of the countries. We have so many different trials. Our work is on most work is on mental health with communities. We have so many successful trials, but their implementation is still challenging. We have so many successful trials, but the gap which I was reading somewhere that there is still 12, 13 years gap in between the research and then their delivery. Specifically, it is even longer in the LMICs, low and middle income countries. So how can we reduce that gap? I know there is a lot of work is going on, specifically in high income countries. But if you talk about low and middle income countries, I haven't heard that term in Africa or in South Asian countries, because they are still having the same old practices. So do you think is there any way to also maybe involve them, maybe build the capacity for their specifically local or community organizations over there, so they also start working, and initiate these kind of things over there, so that they can also get the benefit from these new learning.
I can
Thank
jump
you.
in and say, so I think that's a great question. Congratulations on entering the world of implementation science. I think it's actually the best case scenario for people to enter when they have real implementation experience and then learn about the theories and models and frameworks, because you can immediately see how they apply.
Yeah.
Our experience is low and middle income countries are getting on board with implementation science in pretty impressive ways. Huge parts of Africa are very, very involved. I would say Nigeria is well ahead of the curve, but many other places as well. We have a lot of people we've connected with in South America, and I think that is growing rapidly. Brazil, Argentina. There's a growing, I would say, in Asia, things are coming along, but it's a little bit further behind. But we, for example, give away free spots to anyone in low and middle income countries. We have a draw, and so we give away, I think, 20 free spots twice a year. And we just closed, and we had 386 people, I think, apply this time around. So that's a lot of people who are saying, I'm ready to learn about this. A lot more people from India and Pakistan. And there's a lot of people in Singapore. There's a new hub in Singapore. And so I think that they are trying to expand out. And there was just earlier this month, the first Asian implementation conference that happened as well.
Well, thank you for this answer. It sounds great what you're doing. And I think we have time for one more question, maybe a very quick one from Daniel Kasparavicius. If you could come to us, maybe you could switch on your video and pose your question.
Sure. Thank you so much for this fabulous presentation. I find in that decision maker pool of individuals, they really want to know about the financial benefit of implementation work. So not only the thing we're trying to implement, but also why invest in implementation teams and their training and long-term support. So I was curious to hear if you had any suggestions, whether those be references or example projects that we could use for that decision maker audience that speaks to the value for money of doing implementation work.
I mean, I can maybe jump in just from a research side. I mean, we actually just try to be very systematic about having costing analysis integrated in our project so that we can actually provide an estimate of what implementation costed within. It's always within a research context, right? It's not real world implementation in that way, but implementation as part of a research project in real world. and to also be able to say, you know, per case, for instance, or per family treated, that's what it costs. So we're still in the process of doing this, so that you can kind of give an estimate. And we're just doing this in the one project, and it's actually quite surprising how low the cost is compared to what maybe just more technical intervention or so would cost. But at the same time, I mean, that doesn't always, it's not necessarily convincing, it's just transparency in terms of what it costs. And the idea around here is, how do we build actually capacity for implementation practice and learning systems, and what kind of policy decisions do we need around this within healthcare systems? And I think there we still have quite a long way to go, certainly in Switzerland, because we just kind of start to talk about this.
I can also comment on this. I agree with you, Rahel. It's important to measure implementation costs, and we are doing that also in our study. And at the moment, I think we really have to demonstrate value of implementation science, and we need to get data on return on investment for the funders and decision makers. And I don't know if people have information, ideas about that in the audience, or if Julia or Bastiaan or Tekla, you have further information on that. But I think we need to provide this kind of evidence for decision makers, that we can speed up maybe the implementation of an intervention and make it more efficient, and impact society.
Thank you all. And Julia, I see you provided a helpful summary of a resource in the chat, so thank you.
Well, thanks all for your questions. I think that they now move to the next slide, which should be an activity.
Bitte gehen Sie zur Selbstanleihe, wenn Sie noch etwas mitnehmen möchten. Und bis zum nächsten Mal.
Sorry, I think, looking at the time, we will now move to the final activity, I think. Thanks a lot for all the questions. I think there has been many further informations from Julia in the chat, and I guess you can always have a look at the webpage and contact our panel or people from Impact with further questions with regard to this topic. And now I would like to give the word again to Julia.
Wonderful. So I always like to end a session with a quick little question about, do you have any takeaways from today's session? So you can either annotate them on the board, and you can do that by pulling up the same bar, and this time pressing on the T, the text tool. And so if you press the T, you can literally write on the screen. Then your responses are anonymous. Or if you don't mind sharing with your name attached, you obviously could put them in the chat, but then people can tell who said what. If you would like to anonymously share them on the screen, you could message me directly and I can copy paste them up there too, if that helps. But I always love hearing what people's takeaways are. I feel like it was fun because we had presentations and a panel all woven in together. So I imagine people's takeaways might be very diverse from each other. So I'll give you a moment to share thoughts. Awesome. Well, it looks like there's some wonderful different reflections, as I expected, different directions, thinking about different roles in the system, people thinking about adding a crucial perspective to implementation, but then also thinking about this as a team sport. I really love this one, recognizing that this is emotional, the need for more focus on sustainability and scale, planning for sustainability from the start. Oh, such a good one. Someone's put in the chat, learning about different competencies and functions. So things in a lot of different directions. I'll let maybe people keep adding. Any comments while Tekla, I pass it back to you in case people are still writing.
Yes, thanks a lot. So you've seen we've kind of skipped what is about Switzerland and how can we think about these concepts in Switzerland. And I think it's important to be in discussion and to maybe also bring this discussion to the impact conference and move it there to the field. I mean, to really sit together to think how can we ensure also that we have the systems in place, what kind of groups could we build or get connected to really move implementation practice more to the forefront. And I would like to introduce the panel. Maybe if you would like to say some final words about your vision for Switzerland.
Maybe I can start. I think we really have had quite a bit of movement over the past years, both in research or science, maybe more so than in practice, but I know that many exciting developments are also happening around supporting implementation practice. And I would have the vision that we really create a national infrastructure about implementation, similarly as we do this for other types of like clinical trials, etc., so that we really have a system that creates a learning health system where we have the cycles around knowledge generation and translation and having support systems that really have a specific designate mandate to do this. That would be something, I think, a vision to work towards too. Thanks.
Great. Bastiaan?
Maybe, yeah, I think building on what Rahel said about the national infrastructure, I think for me that means also thinking in basic education, like bachelor, master level, but then also continuing education. But I think at bachelor level we could work on awareness, master level seems like a good place for knowledge, maybe a little bit of skills, and then continuing education, something that we can provide and really drive or work on the skills level. I think Rahel said something about clinical trials, and there you have the statistician. If you want to do an investigator-led trial, the statistician has to be on your project. So lobbying to get, the same view on healthcare projects where the implementation science is a core competency or a core team member of projects. I think that would be also a good push into the future.
I agree with my colleagues. Health economists are also very important, and building capacity, centers of excellence in Switzerland are useful, and educating everyone, and also maybe putting researchers closer to decision makers, working more closely together to see where we want to go in Switzerland. Thank you.
Yes, thank you for those final words. And I would like to thank all of you for your contributions and for this very interesting and inspiring talk. I think what we all can take home is that it should never feel too easy, then something is wrong. We should all think about our inner cheerleader and really bring this up if we talk about implementing projects. And if we are planning to explain implementation to others, keep in mind that the process model might be the easiest to first provide some structure and move this into the heads to help people walk along this structure to get into implementation. Thanks you all for attending this webinar. I very much look forward to welcome you to the sessions in 2026. And we have a very interesting program for you. Please have a look at the webpage and you will be informed about the topics. And with this, yes, I say thank you and yeah, see you. Yeah.